Our first speaker, Dr. Jinesh Mukesh Shah. Dr. Jinesh Mukesh Shah is an associate consultant, Department of Neurology at the National Neuroscience Institute. He joined the Sing Health Internal Medicine residency and subsequently completed his senior residency in neurology in 2023. He has several publications in international journals. Dr. Jinesh will be sharing information on how we can understand Parkinson's disease better. Dr. Jinesh, please.
Hi, everyone. I thank you all for joining us today. It's great to have such a fantastic turnout. I hear there's almost 1,000 people joining us. So, yeah, I hope to share with you all more about Parkinson's disease. So, your trip here is actually fruitful. So, yeah, so the topic given to me today is understanding Parkinson's disease. Now, I'm not sure how much you all know about Parkinson's disease because you've either heard of Parkinson's disease, when you see someone having tremors, or you may be a Parkinson's disease patient yourself, or a loved one, may be suffering from Parkinson's disease. So without further ado, let's start. So what do you think all these individuals have in common? You have Michael J. Fox, you have one of the prior popes, John Paul, Muhammad Ali, as well as the rocker. So all these were all Parkinson's disease patients, right? And Parkinson's disease has often been in the news. For example, the topmost were Apple Hong's father with Parkinson's disease. If you've seen the promotional video where if you are potentially at risk of having Parkinson's disease, then drinking coffee, a few cups of coffee a day may potentially actually cut your risk of having Parkinson's disease, right? And then as we know, that there is certainly a lot of research ongoing in Parkinson's disease, both in terms of finding treatments and how to let patients cope better and live better with Parkinson's disease. So they'll be talking about tech solutions as well as different activities that patients do and how patients live well with Parkinson's disease. So Parkinson's disease, was first discovered by James Parkinson, and it is a neurodegenerative disorder. This actually means, that that the parts of the brain that are important in controlling movement degenerate over time. There's loss of the important cells. Okay, it is chronic and progressive. Okay, so each patient is different. How each patient progresses is different, but the usual tempo is such that it gets worse over time, and this may occur over many years. Okay, and Sister Tan has talked about local figures, but worldwide there's more than 10 million people who suffer from Parkinson's. Okay, so now we have a look. So there are many myths about Parkinson's. So it is not true that only the elderly can suffer from Parkinson's. Parkinson's disease, or I will call it PD for short, moving forward, that there are certain genetic associations of Parkinson's disease, but it does not have to be hereditary, right? You can get Parkinson's disease without having a family history. Tremor may not be a prominent component for all patients who have Parkinson's. And Parkinson's patients may suffer from dementia, but there are many patients with Parkinson's disease who have very vibrant cognition, right? So they don't necessarily have to suffer from dementia. So the incidence, like we know, is about 3 to 8 per thousand, and this increases with age. And 3 in every 1,000 Singaporeans 50 and older. Of course, if you come to a neurology clinic, you see a lot more patients, but it is common enough. Unfortunately, 5% are diagnosed at a much younger age, under the age of 50. So, now Parkinson's disease, it is the organ that is dysfunctional is the brain, and cells that are important for smooth movement are the ones that are affected, and these the ones that are affected, they die over time, and because of this, there's lesser neurotransmitters around to ensure smooth movement of the body. Okay, so the ones that actually the culprit or the important neurotransmitter we're talking about over here is dopamine, right? So there's lesser dopamine over time. So medications actually work on this. So as a result of this, patients manifest motor symptoms, which we will talk about in a while. But there's also non-motor symptoms. So it's not primarily a motor disorder. There's both motor and non-motor symptoms. Okay, so as I was mentioning earlier, they are both genetic factors and environmental factors. Of course, if you do have genetic factors, then your risk of having Parkinson's disease, increases 2 or 3-fold. And the younger you are, the more likely it is that Parkinson's disease may be caused by genetic factors. But there may be environmental factors, things like exposure to pesticides. But yeah, so often it's an interplay between your environment, and other things that may lead to having Parkinson's disease. So yeah. So there's a lot of fluctuation, Parkinson's, when you talk to Parkinson's disease patients, there may be a lot of fluctuation in symptoms. They typically, if you've heard them, sometimes they're on, sometimes they're off, because there are periods of fluctuation, in terms of how sometimes when they're off, they say their symptoms actually are much worse. So there may be a lot of fluctuation in their symptoms. So let's start with the motor symptoms. We talked about there's motor symptoms and non-motor symptoms. Now, motor symptoms, while to the lay public, one of the most commonly known symptoms may be there or tremor. Parkinson's disease is actually defined by slowness of movement, and this is what you may see in you should be seeing in Parkinson's disease patients. When they do things, hand movements or body movements are slow, and yeah, they're slow. And in addition to this, you will see tremors, of course, and lastly, they have stiffness, okay, of their limbs, their trunk, okay. And then as a result of all of this, and additionally, they may have issues with their gait, problems with gait and imbalance, okay. So to kind of summarize the symptoms that they have, they have stiffness, they have slowed movements, and they have tremors, and this may contribute to unsteady gait. So they have a very characteristic gait, which I will show in a video later. So, okay, are you going to play the video? So this video is taken from YouTube, yeah. You can see certainly the movements are actually, so compared to the right side, the left side, the movements are slow. And after doing the action a few times, the amplitude of the movement actually gets smaller and smaller and smaller, and this is actually characteristic in Parkinson's disease, and this may be seen in the limbs as well. So this was to manifest to you what we know as bradykinesia, right, or slowed movements. Okay, next slide, please. Okay, now you can play the video here. This will be to demonstrate the tremor that is characteristic, often known as a pill rolling tremor. Yeah, I can play the video. Right? These are the kind of tremors that you may see. They kind of have this kind of pill rolling kind of tremor, but tremor may not be restricted to the hands. They may also appear in other parts of the body. Okay, so other motor symptoms, you may have seen these people have reduced facial expressions, they've reduced blinking, their posture may be stooped, their voice is actually soft. In fact, if you actually ask them to write something, their handwriting is actually quite small, and that's an interesting thing, that Parkinson's disease patients may actually tell you that, with time, oh, my handwriting's actually gotten smaller. So yeah, if you have, if you after this you go back, you're concerned one of your relatives have Parkinson's, one of the interesting things you can do is ask them to write something and see your handwriting's gotten smaller. Yeah. Okay, you can play the video. Okay, so this video is to kind of demonstrate to you how patients with Parkinson's disease may actually walk, and their gait is quite characteristic. Okay, let's have a look. Right, so you notice the person may be slightly stooped forward. There is very reduced arm swing. Okay, the stride length is actually very small. And when they turn, they sort of what we know as turn in very small steps. So so Parkinson's disease patients walk in a certain way. Yeah. Okay. Okay, I think let's go on to the next slide since we've already seen this. Okay, so what are we talked about the motor symptoms and I hope that's helped you gain an understanding of what the motor symptoms actually comprise of. So next will be the non-motor symptoms. Now, constipation is a very, is something that we see quite often that may occur quite early on in Parkinson's disease. So I don't want you going back thinking that, oh, if I have constipation, do I have Parkinson's disease? I don't think you should think of it that way because constipation is extremely common. But this is something that can occur in Parkinson's disease. Yeah, the other symptoms, there may be early loss of smell. And okay, so one of the things there is REM, sleep behavior disorder. It's a lot of words, it sounds confusing, but typically, these patients report, and this can start many years before Parkinson's disease, where patients, their partners, the poor patients won't really know because they're sleeping. The partner complains that, oh, my wife or husband was kicking and screaming in their sleep. So if the patient is aware that is doing it, then you need to call police lah. But if the patient is unaware, and the partner is complaining of this, then perhaps you should bring this up to your doctor, and we will investigate accordingly. There may be mood disorders and all sorts of other symptoms as well. Now, just to kind of touch upon briefly on this, Parkinson's disease. So the symptoms I talked to you about, the motor symptoms I talked to you about, so those sort of comprise of Parkinsonism. There are many this is outside the scope of today's talk actually, but there are many variants of Parkinsonism. Today we're just focusing on Parkinson's disease lah. Yeah. So sometimes in the variants you may see other symptoms. Okay, so so yeah, early symptoms like you see, there's reduced facial expression, there's the tremors. They could have non-specific symptoms like a frozen sensation of shoulder stiffness, feels frozen, or just difficulty doing their common tasks, difficulty eating, because of all the tremor, and the voice gets soft. So there are staging scales actually to describe how severe one's Parkinson's is. Not to get too technical, but basically this is actually broken down into the degree, based on the degree of functional impairment that a patient has, whether you are and the degree of extent of involvement, is it affecting one side versus how or whether you're completely debilitated. Okay, so now before I carry on, so I think it's good to stop here and kind of appreciate that Parkinson's disease is not life-threatening, but I think for patients who do suffer and their caregivers, it certainly changes their life significantly, and that's where treatment comes in. Now, PD at its heart is still a clinical diagnosis where your doctor, especially your neurologist, takes the history, examines you, and based on the examination makes a diagnosis of Parkinson's disease. There may be further tests that may be needed, to rule out other causes. So the treatment is more precise and accurate, such as brain scans, and especially in those who have very young onset Parkinson's disease, then further tests like genetic tests and everything may be indicated. But investigations are variable on per patient. Okay, whilst Parkinson's disease doesn't really have a cure, now there's a multitude of treatment, non-pharmacological or without medication, as well as for certain small subgroup of patients, potentially surgery. Okay, and as well as to manage with these symptoms, there may be relevant assistive devices lah. Okay, so let's start with before we start with medications, always, we always try, what if I don't take medications, right? So now things like exercise has, I don't need to belabor the point that exercise is important for many health conditions and for overall good health. And exercise itself may slow decline. So, whether it's you prefer doing Tai Chi, going on walks, playing table tennis, like what the first slide actually showed, I think exercise is important for both Parkinson's and non-Parkinson's disease patients alike. But it's useful. You got to keep moving to make sure that your body moves smoothly. Um, and even a little bit is will be useful. Okay, then proper nutrition and there is a very important role for patients with Parkinson's disease. There's a very important role of our allied health colleagues regards to physiotherapy, occupational therapy, and speech therapy. But I won't step on their talk, and I'll let them elaborate on that further. But they play a very important role in helping our patients optimize their quality of life. Okay, so what are these? Once in a while, you may see this see this in the news, and they sound really fancy and all. Okay, so this is a wearable tracker, to sort of that's FDA approved, to sort of track what are the patient's actually movements like, and perhaps this information can be passed on to the doctor who can make better treatment decisions, right? And then this is a sort of you imagine this is sort of kettle, for those having tremors. This kind of stabilizing device will be quite useful in making sure they're not spilling their tea and coffee all over the place. So same thing. Oops, whoops. Yeah. So as well as this kind of gyroscopic specialized spoons, right? For those having tremors, then they'll be useful in reducing the effect of tremors, so that they can actually be more functional. Wearable robots that actually help the patient walk more normally. Right. So in general, I think these are details that you probably don't need to concern yourself with, but they kind of divided into two groups: are those that contain levodopa and those that don't contain levodopa. I think the main workhorse of the main medication that we tend to use is Madopa, but there are many other medications based on patient profile. If tremor is prominent, things like that, then we can use those. So yeah, this is just a chart describing what they all look like. So very often I get patients tell me, oh, it's the white pill. And I'm like, I wish I could help you, but I agree, can't. So many pills look alike. Okay, so the overall tempo, as I'll show in a graph later, now often when we talk about Parkinson's disease, we're looking at a progression of 10 years. When I say 10 years, I am looking after, say, 10 years. Each patient is quite different, right? Some patients do much better, some patients don't do as well. But when I say 10 years, I mean like we would expect, the Parkinson's disease to have progressed somewhat in these 10 years, such that patients may require assistance, may require some assistance with activities of daily living, or change in their baseline condition compared to the past, compared to 10 years ago. Right, so the first few years are considered like honeymoon period, because like first 3 to 5 years, where symptoms are generally mild, the patients are responsive to medication, and off periods or periods where their motor symptoms are prominent are less. Okay, so they're less bothered by symptoms, right? So this is what it kind of looks like, right? Because this means that if you see and this kind of shows the chart like, where fluctuation. So you can imagine in the first, in terms of fluctuation, earlier on it's much smoother, it's easier to control. Whereas later on, what this graph is basically trying to show is that there's a lot of fluctuation, so medication control becomes a lot more challenging. Okay, so what the doctor may do is that may add on further medications, adjust your medications, and DBS actually stands for deep brain stimulation, which is the surgical thing I kind of talked about. So they put this is probably only done in a very small number of patients with Parkinson's disease who are eligible candidates. So this is definitely not first line. And that's why you probably don't hear of it very often. But essentially involves putting a stimulator and an electrode in the brain. Okay. Yeah. Okay, so as alluded to earlier, Parkinson's disease, while we primarily know of it as causing motor complications, it does affect a whole range of systems. We talked about constipation as a manifestation of gastrointestinal dysfunction. It can affect the urinary system, sleep, lo- and it can cause falls. It can cause mood problems. It can cause problems with your blood pressure, when you change position. So potentially it can affect a lot of systems. But we do have, I think, don't get disheartened. We do have treatment to try and best manage it. Okay, so now I think the managing Parkinson's disease is really a team effort. Okay, I will help to diagnose the condition, prescribe medications, but the patient has, there's a lot of symptoms that I need the assistance of my physiotherapy, occupational therapy, speech therapy colleagues to manage, nursing colleagues to actually manage. And then in addition, the family physician may actually help with symptoms, when there's certain symptoms that I'm unsure of. And sometimes if there are complications involving or symptoms involving other systems, then other specialities may actually get involved. Okay. Okay, so Singapore actually has a Parkinson's disease society, and this was actually formed almost 28 years ago. So this may be relevant to patients who have Parkinson's disease and therefore may be able to find support with other Parkinson's disease warriors. And I think that may be very useful for some people hearing, motivating each other, learning from each other how each other actually manage the condition. And it's also really important for caregivers as well, to find strength from each other. So I think we can be firmly confident that treatment for Parkinson's disease will become better with time, with improving research actually. And I think if you do have Parkinson's disease, I think the take-home message is, while there's no cure, I think there's a lot of treatment around, and you can live pretty full lives with individualized treatment and proper support and care. Thank you for your interest and attention. Yeah. So I think questions are coming later on. So just write them down if you do have any questions. I hope it was clear. Thank you.
Yeah. Thank you, Dr. Jinesh. Our second speaker, we have Ms. Yusani Chok Pokosat. Ms. Yusani is an advanced practice nurse at the Department of Neurology, Singapore General Hospital. She's the core team member of Parkinson Multidisciplinary Team and has APN-led clinic to see patients with Parkinson. She supports patients and caregivers as facilitator and speaker at Parkinson support groups and involves in many outreach programs. Ms. Yusani will be sharing about living well with Parkinson's. Ms. Yusani, please.
Very good morning to everyone. I'm really glad to be here to share on living well with Parkinson's. Wow, I see so many familiar faces here from people with Parkinson's support group and also from PSS. Nice to join us for this Saturday morning. So this is my scope for today. As Dr. Janice had shared earlier on, Parkinson have different stages and everyone affect differently for motor and non-motor symptoms. Knowing how to live well with Parkinson actually can help people with Parkinson and loved ones to have quality of life. These are the simple tips that I'm going to go through today on how to live well with Parkinson. Having open communication is the key by communicating well with your loved one and the healthcare professionals. Educate yourself and your family by being here today. And I'm so glad that all of you are here, either on site and at the Zoom. Adapt and coping strategies are important. Will be shared by our occupational therapists more later on. Comply to medication and symptom management also very important, because I will highlight later on why it's so important. It's important to engage in the activities, because engaging activities make you move. Because Parkinson is about motor, right? As long as you move and you feel better. And with the support system that you actually provide in the society by Parkinson Society and also the support group and even the online help, actually provide the support and mental health system that actually support people with Parkinson and the caregivers. The exercise that prescribed by physiotherapists and also nutritional status that actually prescribed by our dietitian are important to follow. And practicing mindfulness and relaxation are essential to cope well with Parkinson. So the next few slides, I'm going to share more in details. First, partnership with your healthcare professionals. Follow your doctor's instruction. As Dr. Janesh mentioned earlier on, the people with Parkinson may be prescribed with Madopa or even other medication at the earlier stage of Parkinson disease. So it's important to follow the medication accordingly. As we comply to medication, and you note down the symptom that experiencing, both motor and non-motor. And you have to let the doctor know whether you take it before meal, after meal, and what they're asking you to update accordingly. Looking at what is work for you, because this is important so that the doctor can adjust your medication accordingly. But if you experience any side effect, such as dyskinesia, like involuntary excessive movement, that can happen at the body, arm, face, or even the limbs. And then you have to let the doctor know so that they can know when to cut down the medication as well. Prepare prior to all medication, medical appointments. This is important because the doctor duration of seeing you might be a little bit short if there's many patients at the clinic. So it's important to note down the key points you want to ask the doctors or even nurses or the therapists so that you can ask the question you want to ask and address your concerns. And communicate effectively with the healthcare workers is the key. And also bring along your loved one so that your loved one can know about your condition better and help you to manage with the condition. Social engagement is very important. We have the booth behind. You all can visit later on. You haven't go. Parkinson Society actually provide the many available resources, which Phyllis will be sharing with you all later on at the later section. And by joining the support group at your institution, also important to connect to one another so that people with Parkinson can share the experience, and caregivers also can learn from one another and support each other. Agency for Integrated Care, or we know at AIC, provide a one-stop service. If some of you have logged on before, right, they actually have many services available, such as like daycare, even home health services, or even respite care for the caregivers. Online available resources are the way to connect and learn and know more about Parkinson. This is Parkinson Care app. In 2022, actually in junction of World Parkinson Day, with the multidisciplinary team effort, we actually came out with this app that help you to manage with Parkinson's symptom better. So the key function are symptom trackers, monitor and record symptom on when the effect of medication take off, wearing off, meaning that the medication is not doing so well because it's off period, or when you're having discomfort, such as aching or cramps, and bowel movement. We also can monitor the blood pressure and even fall diary and even sleep patterns. My goals. Allow patients to set simple goals, such as do 3 simple exercises a day. This is part of motivation and reminder for you. Exercise diary contains of videos, guides demonstrating exercises that are useful for people with Parkinson. And also for caregivers, you can use this to do together with your loved one. And also provide medication reminder so that at the first time when patient log in, you can key in the medication coming. This is to help you to take your medication on time. Last but not least, also provide appointment reminder and also useful resources. For the caregivers, you can actually go in and look at the available resources that can be helpful for you. This is how you download the Parkinson Care app. You just go log into the SingHealth Health Buddy. It's available in both Android and iPhone. So you go to the specialty care under Parkinson. For the first time that you log in, you just key in your profile, your details for the first time, and subsequently you just put in some of the symptoms you're having. So this one you keep track. You can bring along this diary as a part important for your appointment as well. So you can tell your doctor about these are my blood pressure, this is how I feel, and how the doctor can help you adjust your medications. Healthy habits are very important because as we develop Parkinson's disease, we establish the routine early, they become part of our habit. So the 3 things that I'm going to highlight will be nutrition, rest and sleep, lifestyle adaptation, or in short, we know that eat, sleep, and play. So nutrition, eating healthy with adequate hydration is very important. With the high fiber and adequate fruits and vegetables, this will help you with your constipation management. At the same time, let's look at the healthy plate. Healthy plate is actually a guide for us. It's very easy to remember. You divide the plate into half. One side is the fruits and vegetables. The other side, the 1/4 will be brown rice or wholemeal bread, and the others will be the meat and the others. And also highlight the importance of choosing water over the sweetener drink. Okay, and also incorporate active lifestyle and use healthier oil. So if you're not very sure, you can actually inform the doctor. We can actually refer you to dietitian. At the same time, for those patients with more tremors and even dyskinesia, you may actually burn more energy. So you may need to have some nutritional adjustment accordingly. Rest and sleep. Getting enough rest at night is very important so that actually you can stay awake during the day. You can enjoy the activities and engage in activities instead of sleep during daytime. Try to adjust your timing of rest and sleep. Sleep hygiene practice is important. Example, like don't drink caffeine, tea or coffee before you sleep, or don't watch TV drama until very late. And it's just try to stick to the daily time of going to bed and sleep at night. Relaxation technique, meditation and mindfulness practice also helpful with the sleep. Discuss your sleep concern with healthcare providers. Some of the patients might have like excessive sleep during the daytime, or even like dream, or even shouting at night, or even certain symptoms that you have. You can actually inform your doctors, and the doctor will actually explain to you what are the strategy that can be done. Sorry, I cannot move. Sorry. Okay, next slide is on the lifestyle adaptation. It's important to plan ahead on your activities of the day and always have plan B in mind. For example, now it can be raining, right? See, okay, outside it's already raining, right? So we have to always have plan B. Whatever we are doing in life, we always plan ahead so that we don't feel stressed and anxious that you bring umbrella along. I see a lot of you bring the umbrella, right? Very well planned. Okay. Optimize the activities during on time. As long as you know what your on and off time. On is mean medication kicking in, you're feeling good about it with the Parkinson symptom. Off is mean medication is wearing off. To adjust your lifestyle and the activities accordingly. This will help you to manage better. Bring extra medication along when you are out, because sometimes we don't know whether we will be delayed by the traffic jam or other activities like you're going out a bit longer, so that you don't miss your medication and you take your medication on time, and this won't compromise your symptoms. Practice self-care and appreciation for your loved one. This also help to strengthen your relationship at the same time, also less stress for everybody. Okay, planning ahead is very important. Have you all heard about advanced care planning? Anybody know about it? Can lift up the hand, I see. Wow. Only a few people. Okay, let's go through today. Advanced care planning is what we are actually establish the conversation with your loved one on what you want actually to what you want the care of preference at the end of life. For example, if you cannot eat, right? Whether you want to have a tube feeding, and even one day we cannot breathe, whether you want to have a tube to put in and then connect to the ventilator to breathe. So sorry about the technical, because this one is not working. Okay. So advanced care planning actually is a conversation that you can start thinking through. So it's the conversation that we could document in the health system. This is not a legal document. So at any point of time, you have any change in your preference of care, actually you can tell your ACP facilitator or inform the doctor. Then it can be amend the health system. Okay, this is not a legal document. So the next one that we're going through is the finance and legal planning. We call it lasting power attorney or LPA, which I will share a little bit more later slide. And also try to involve your family and friends and your loved one. Because if you do LPA or ACP, don't inform your family members, they may not know. And then when they, if the doctor start calling someone that someone is sick, and then you may not be aware. So it's good to start the conversation now. So advanced care planning information can be found in the AIC website. And this booklet, actually it's come in all different languages, English, Chinese, Mandarin, and Tamil. It's a booklet for us to start looking through and start thinking through what we want if actually we cannot make our own decision at that point of time. Lasting power attorney, LPA, actually is a legal document and a deed. It allows a person who at least 21 years old, call themselves a donor, to voluntarily appoint one or more person, up to 2 people, donees, to make decisions and act on his or her behalf if he or she loses mental capacity one day. A donee can be appointed to act in the 2 broad categories: personal welfare and or personal property and affair matters. Give the authority to the donee to sign deeds to the donor's behalf. The benefit of having LPA enables a person to make a personal considered choice of a trusted proxy decision maker who is reliable and competent to act on his or her best interest should she or he lose mental capacity one day. And also alleviates the stress and difficulties faced by the loved one who need to apply for a deputyship order if the person lose mental capacity without LPA in place. This slide actually just show and guide. Just now we went through about advanced care planning, lasting power attorney, advanced medical directive actually is a legal document that you want to tell the doctor that I don't want to be safe in the event that I'm lost mental capacity. But this is a legal document. And will planning and CPF nomination also important that we can actually plan ahead. So when someone lose capacity, the LPA will come in. They will help with the personal affair and property and affair. And when someone pass on, the will planning and CPF nomination will activate it. So this come to the last on checklist for living well with Parkinson. Keep a diary of your symptom. You can use the Parkinson app that I shared earlier on, or you can use your phone, or even the notebook that is comfortable for you. Bring along for all your appointments so that you can remember what you want to discuss with the doctors and healthcare professionals. Exercise daily. Exercise daily is important because it actually helps to improve symptoms of Parkinson, promote sleep, and improve your mood. Medication reminder, you can set the alarm on your phone, or you can use a pill box, or even you can use Parkinson app to help you to remind to take medication on time. Reach out to people with Parkinson and family members for support. It's really important because we are not alone. We always have friends and family along. So always remember that, always reach out to other people. Enlist the help of professionals for lifestyle and home modification. Our occupational therapists may tell you about home modification accordingly if you engage them. And even you can go to HDB under East program for installation of a grab bar. You can actually have a look at the website. Watch out for signs and symptoms of depression and dementia. Last but not least, always seek professional help early. The take-home message that I want to share is, after your understanding for Parkinson's disease progression by Dr. Jinesh earlier on, always remember, adhere to medication schedule and prescribe exercises by our physiotherapists. Planning ahead actually can help you feel at ease. At the same time, also reduce stress. Knowing the tips and living well with Parkinson also enhance the quality of life. People with Parkinson can live well as much as normal people. People with Parkinson can be better control of symptom and disease progression to make living with Parkinson manageable. Stay at present. Every day is like a gift. Always count your blessing. Be grateful for what we have because happiness always starts from within and you know that you're not alone. Like today, y'all can start to network with one another and make friends and even connect to other people like PSS and even other professionals that you see today and make one another as a connection in this community. These are my references. And thank you so much for your attention.
Thank you, Miss Yusani. I'm sure we had a very interesting session that we have. So next up, we're going to have Miss Ng Hui Shin. Miss Ng is a physiotherapist from Singapore General Hospital who has been working in SGH for 7 years. She specializes in neurological rehabilitation and is seeing patients with neurological conditions, including Parkinson in an outpatient setting. She's also one of the Parkinson's multidisciplinary team members in SGH. Ms. Ng's topic today is exercise for Parkinson's. How much is enough? Ms. Ng, please.
Good morning, everyone. My name is Hui Sing. Okay, today I would like to talk about exercise for Parkinson. How much is enough? Okay, this will be the agenda for my talk today. I will talk about the importance of exercise in people with Parkinson's, What type of exercises should people with Parkinson to perform? And exercise guidelines for each exercise? And how should we exercise at appropriate intensity? And some take-home message from my today talks. Okay, Dr. Jinesh has talked about what is Parkinson, but please allow me to revise with everyone again. Parkinson disease is progressive neurodegenerative disorder that affect movement due to reduction in production of dopamine. Dopamine is a chemical messenger that help us to move and control our movement without really thinking about it. So your spouse might sometimes might nag on you to do exercise, and even your friends and your family member are constantly encourage you to do exercise. Your doctor has been telling you that exercise is a vital component of Parkinson treatment. But why do people with Parkinson need to do exercise? What does exercise actually do for someone with Parkinson's? Is there any evidence really show that exercise really help with people with Parkinson's? Can anyone share about your thought and exercise with me? For those who has been walking exercise, do you found any benefit of exercise? Yeah, don't be shy. Can share with the public over here and can share with me. If not, I will go on to tell you the benefit. Okay, so all of us understand that Parkinson's cannot be cured, and medication like levodopa is to help us to control the symptom. For example, body stiffness, tremors, and slowness of the movement. But research showed that exercise acts as a natural medication which help to promote neuroprotections. And the most important thing is to slow down the progression of Parkinson's. So what is neuroprotections? Neuroprotection refers to the ability of the treatment to preserve our brain cells from deteriorating. Besides that, exercise can improve our both motor and non-motor symptoms by improve our cognitive function to think faster, to react faster. And also can improve our depressions because exercise release endorphin and also improve sleep quality, help to reduce fatigue because exercise improve our muscle endurance, cardiac and lung functions. Also, exercise improves the drug efficacy as well because exercise help to improve the absorption of medication and make our medication more impactful. Lastly, exercise help in improving balance and reducing the risk of fall, in which the medication has limited effect when our condition progress. So for those who have been doing exercise regular, for example, walk at the park, some of them might thinking that done one type of exercise daily is good enough already. But is that really true? So just now I have talked about so many benefits of exercise, and then some of you might have decided to start to do exercise from today's onwards. So here comes the question. So how long should I do for my each exercise? And then what kind of workout should I do? And then how intense should my workout be? Okay, so exercise for Parkinson's, we encourage people with Parkinson to perform all these 4 types of exercise. So we will start. So the first one will be the aerobic exercise. For example, you can choose to walk on the treadmill, or you can have a brisk walk at the park, or you can perform the stationary bike at home. because aerobic training is help us to improve our muscle endurance, the most important thing is to improve our cardiac and our lung function to reduce the fatigues. The next one will be the strength training. Okay, we can, for the strength training is to help us to improve our muscle strength and to maintain it as the condition progress. So we can use our own body weight, or you can choose to use the machine, the weight training machine at the gym, or you can use the dumbbell or resistance band for the strength training. The next one will be the balance and agility training. So as the condition progress, some of the people with Parkinson, their balance, their walking balance, their standing balance might be affected. So we need to start to do balance and agility training as early as possible. You can perform like exercise like stepping exercise, or you can sign up for Tai Chi or dancing class, or even kickboxing class to, if you are able to do. The last one will be the flexibility training. You can choose to use the towel or the long stick or non-elastic structure to perform all the stretching exercise. So this table shows the exercise guideline for each exercise. For aerobic exercise, we encourage people with Parkinson to perform at least 3 days per week. And the exercise intensity is from moderate to vigorous, not leisurely walk or leisurely cycling. I will explain this further in my next slide. And to perform each aerobic training for at least 30 minutes and build up to 150 minutes per week. For the strength training, we encourage people with Parkinson to perform 2 up to 3 days per week, and each movement repeat for 10 up to 15 repetitions and repeat 1 to 3 sets. By targeting the major muscle group, for example, our thigh muscle, our knee muscle, calf muscle, upper back, lower back, arm, and chest. For the training, also same as the strength training, you can perform from 2 to 3 days per week and progress from hand support to without hand support in a safe manner. You can consider to add dual task, meaning while you're doing the balance training, you can do some mathematic counting in your mind, or you can have a conversation with your partner or holding a cup while doing the balance training. And each exercise will be 30 to 60 minutes and up to 2 to 3 hours per week. For the flexibility training, which is stretching exercise, doing daily being most effective. So you have to stretch up to the point that you feel the tension or pull of your muscle and hold it for 15 to 60 seconds and repeat 2 to 3 times. Okay, how should we exercise at appropriate intensity? For those who have fitness tracker or smartwatch or oximeter device, you can use all these devices to help you to monitor your heart rate during the training in order to exercise at a desired level. So now I would like to talk about target heart rate reserve. What is target heart rate reserve? So it is a number to help us better understand our fitness level and how hard we are working during the exercise. So everyone, please take out your phone, scan this QR code. So you will come to a page and then you scroll down the page. Scroll down the page and you will come to this calculator. Okay, so please enter your age. For example, my age is 30, not 29. Okay, and my resting heart rate is about 80. And today I would like to choose my exercise intensity to be hard. Okay, but for all of you, I encourage you to progress from moderate intensity, then gradually to vigorous intensity. So, and this will be my target, my target heart rate to be achieved during exercise, from moderate to hard. For all of you, I encourage you all to start from moderate to hard. This table shows that the target heart rate from moderate to vigorous intensity according to different range of age. So you guys can refer to this table to check your target heart rate. You should achieve this heart rate during the exercise. So what if you do not have these fitness trackers, much work, or even your heart rate is below than 60 beats per minute or used to be quite low? So I will encourage you to use this rate or perceived exertion chart to monitor your exercise intensity during the training. So for moderate intensity, when you're doing the exercise, you will find your breathing heavily, but you still can continue a conversation. For the vigorous intensity, you will start to feeling shortness of breath and you only can speak a sentence. So there is some alternatives to aerobic exercise. So you can perform a series of assisted or standing repetitive movement at home if you are not able to cycle or brisk walk because of limited mobility or limited resources. You can. So here is the example of the assisted or standing exercise for people with Parkinson. So you can go to YouTube and then subscribe to a channel called Power for Parkinson, because in this channel there is a lot of video for the assisted and standing cardio workout exercise for people with Parkinson. So this is the example, but I'm not going to play all. So you can choose some of the video that you think is suitable to do it at home. If there is a raining day, you are unable to go out for a walk. So some of you might think that I do not have a lot of time to complete all these 4 types of exercise because of work, because of my housework, because I need to spend time to my family member, I need to bring my grandchildren to the school. So is it possible to combine different training? Is there any exercise cover aerobic training and balance training together at the same time? The answer is definitely yes. So for example, we can do the stepping exercise on 2 to 4 inch step. So when we are doing stepping up and down from the backward, we are actually cover the balance training as our body need to go forwards. So if you do this stepping up and down exercise for 1 to 3 minutes, it will be considered as aerobic training already. And then up and down this movement, we're targeting on our thigh, knee, and calf muscle for the strength training. Okay, so you can see the video. Yeah, can help me play the video? Yeah, so when people come down, we have to get our body to go forwards instead of go backwards. So this is considered one of the balance training. It looks simple, but it might difficult for people with Parkinson, especially those in the late stage. Yeah. So we can start to do this exercise early. And if you want to improve your cardiac function, you can do it for 3 to 5 minutes. So So let me continue. For kickboxing, when we're standing on one leg while kicking with the other leg, we are cover balance training. So when you do this exercise for at least 5 minutes, it will be considered as aerobic training. And because kickboxing require both hands and leg coordinations, so it will be another agility training as well. So we can also do the lunges together with can help me play the video? Yes. So when we're doing lunges together with the dumbbell lifting, we are actually cover the balance training because we need to stand in one foot in front of the another foot. So, and then when we're doing lunges, this movement, we are cover the strength training for our knee muscle. And then when we're lifting our dumbbell, we are covering the strength training for our hands. So, and this also consider another coordination training because it is a dual tasking. You need to lift out hand while stepping backward. So you can scan this QR. The exercise guideline that I have mentioned before is created by American College of Sport Medicine together with Parkinson Foundations. So you can scan this QR code to download this guideline for your future reference. So lastly, I would like to re-emphasize to date, exercise promote neuroprotections and slow down the progression of Parkinson. We need to perform exercise at moderate to vigorous intensity for 150 minutes per week in order to get the benefit of aerobic training. Lastly, make exercise as a habit. You cannot miss the exercise just like you cannot miss your medication because exercise is medicine. Thank you, everyone. Have a good weekend and remember to exercise.
Please stay for the Q&A session and take a seat in front. We shall now commence our Q&A session and address some questions from the attendees. May we invite Dr. Jinesh and Ms. Usani once again to take a seat at the front. Scan the QR code or screen to enter the Pigeonhole Q&A room and post your questions. The link and event passcode can also be found in the chat box for Zoom participants. Our colleague Rajeshwari is the moderator for this session. So Rajeshwari, over to you, please.
Thank you, Jeremy. Good morning, everyone. We have quite a bit of questions coming in. So I will just start first. Maybe this one, Hui Xin can answer.
Yeah.
For walking exercise, is it better to try walking faster in smaller steps or walk slower in bigger steps?
Okay, so for those who have the smaller step issue, I will get them to practice to step in bigger step first. So one, they are get used to the bigger step for like at least 1 minute. I will get them to increase the speeds. Okay, so this training I will encourage you to do on treadmill, but not everyone will get used to use the treadmill. So I will encourage you to consult this training from your physiotherapist. Yeah, so to start with walk with bigger step, then slowly to increase the speed. Yeah.
All right, thank you. Next question. Client's problem is that next of kin is not doesn't understand the physical and mood changes brought by the condition. Is there a hotline for client to call when they need counseling? Also educating next of kin on better caring patient.
Okay, thank you for the question. This one, I would recommend to speak to your doctor first, and then the doctor refer you to speak to the nurse specialist. In different institutions, you have a nurse specialist that specialize in Parkinson's disease. They will talk to you and your loved one on the motor and non-motor symptom. The non-motor, like the mood and all, and even sleep issue, is good to address earlier. So if you are newly diagnosed with Parkinson, please inform the doctor that I haven't get education. Is there any way I get to know more? And also, you can even log into Parkinson Society Singapore that you have many available useful resources available for you to look up on the Parkinson disease.
Thank you. Next question. Will motor skills worsen rapidly without any medication for Parkinson's?
Hi, so thank you for the question. So as I mentioned earlier, the overall progression and tempo of Parkinson's disease is one that is chronic and progressive. So without medication for treatment of the condition, yeah, you would expect a patient to worsen in terms of motor skills over time, and this time is defined in years, not weeks or months. So not really rapidly, so in terms of years, 5 years, 10 years kind of thing. Medication is to improve the symptoms, yeah. So I hope that, but naturally without medications, because these medications don't really cure the Parkinson's disease per se. When you take the medications, there is control of the symptoms. If you don't take the medications that day, then your symptoms may not be controlled. But it doesn't change the underlying progression of the disease. It doesn't retard the progression of the disease. I hope that clarifies. Thank you.
Next one. Is PD a form of dementia?
Okay, maybe I'll just take that one.
Yep.
So I think PD primarily, Parkinson's disease is primarily a movement disorder. Because it is neurodegenerative, there's death of cells. In some patients, in advanced form of the disease, there may be cognitive, meaning memory disturbance in some patients, but primarily it is a movement disorder problem. It's not really a cognition, it's not primarily a cognition problem. Okay. What's the next question?
For next one, for lunge exercises with dumbbell, what's the recommended dumbbells weight, and how long is the recommended duration?
So for lunges, the exercise that I mentioned just now, so it's one of the exercise example. So for the dumbbell, right? So if for those who do not have dumbbell, so I will encourage you to use 1 liter water bottle filled with the water, or you can get the 1.5 liter water bottle if you are able to lift up. So if you are able to lift up the weight for 10 repetitions, then it's your suitable weight. So for the dumbbell, you can choose like maybe start with 2 pounds. 2 pounds is equally for like 0.8 kg or 0.9 kg. So you can start with the lightweight first and then slowly to like the weight that you are able to perform for 10 times only. Then that one will be your suitable weight. And then you can repeat this exercise for at least like 20 up to 30 repetition. I won't say about the time. You can choose the own time on target, but at least perform 20 up to 30 repetitions. Thank you.
All right. There are 2 questions about electrical impulses and electrical stimulation. Maybe Dr. Jinesh can share a bit briefly about it.
Yeah, okay. So thanks for the questions. I see some of you are quite up to date with the news. So yes, these exist, either in the form of magnetic stimulation or electrical stimulation to the brain. But these are not I think there's still more research needed, because early research suggests that perhaps there may be benefit, but I don't think I don't think there's been any definitive conclusion such that these treatments can be brought in as established first line treatments within our local hospitals. So the short answer is yes, it exists, but it hasn't been proven, and therefore we do not use it as of now. But watch this space. I perhaps in 5 or 10 years, if evidence is supportive enough, then we may consider using it, because why not? We want to try everything that is safe and works for patients. Yeah.
All right. Maybe this one, Sister Usani can help to answer. Can share a little bit more on advanced care planning, how to do it. What are the steps?
Okay, thank you for the question. Advanced care planning, first step, I would recommend you go to the AIC website that I recommended. Just type advanced care planning in the Google. Then that you can even go into different languages that you're comfortable with. Then you go look through the booklet, because there's a PDF booklet online. First step, you look through first, then you thinking through. Because this is not a rush that you must do now, but it start conversation with you and your loved one. It's very important, because if we don't sit down and look at the questions, we don't reflect on what we want in life. This can be for everybody 21 years and above. You can start doing the advanced care planning, not only people with Parkinson's. So it's important to start thinking through what we really want when we are unable to make our own decision. And after that, you talk to your doctor first. Your doctor will recommend you, okay, let me refer you to the advanced ACP facilitators. Different hospital got different facilitators, can be like medical social workers and even trained nurses as well. They can make an arrangement to do for you. But you can't come down for the on-site one. You can discuss with them whether you can do the Zoom one, because some hospitals have available Zoom services. Some hospitals may charge, but not all hospitals charge on this. And of course, remember first, before you go for it, you have to talk to your loved one and ask who can be my spokesperson, because you cannot go down alone and tell the facilitator, I want to do this. But you cannot be there alone. You have to bring your loved one along. So the conversation you start in a group, and you can refine accordingly. That will be recorded down in the health system. Okay.
Thank you, Sister Osani. Next question is about sleep. Someone has very bad quality of sleep and prefers to sleep in seated position. How to help him sleep better?
Okay, firstly, we need to know whether this person has any underlying lung condition first. Is it any reason why want to sleep in that position, or is it because of back pain or any? We have to rule out all this first. Talk to your doctor first. If there's not have, and then we can see whether how we can help, because everybody have different preference in sleep, right? Some of us like to sleep lie flat, some of us like to sleep laterally, and even prone. So we need to know, is it because of the drooling of saliva that causing them to sitting up and then you feel better? This time we have to talk to your doctors first and also refer to the appropriate healthcare professionals to give the intervention.
All right. Next one is about assistive device. Someone has difficulty sitting down and standing up. What kind of assistive device will help? He cannot sit comfortably. Is there any chair in the market that will help?
So for someone who have difficulty in perform sitting to standing, so at first we will introduce like maybe walking frame in order to help patient to have the support to standing up. But I will prefer that to refer this person to physiotherapy, because sometimes it's not that your dad is not able to standing up because of the weakness. Sometimes it's because of the movement, the slowness of the movement. So as physiotherapists, we teach some movement strategy to help with standing up. Yeah. But if the movement strategy is not applied to someone, then we will introduce the some existing assisted device, like for example, walking frame, so that the can hold onto the walking frame to standing up. Yeah. So is there any chair like in the market that will help? So for some of the chair, like for example, we call it as geriatric chair. Some of the chair can lift up the height. So this kind of chair, you can lift up the height, the easier for your dad to standing up. Yeah.
One more question for you. How to encourage PD patient to start exercise when they already have limited mobility range?
So we have to kind of brainwash, brainwash again. Yeah. So to tell them, yes, I has faced a lot of patients. Yeah. So even the pulse nagging all the times, but the patient still like that. So if can, we try to change the environment. Yeah, because the house is four walls, because maybe they lost of motivation. So like what Sister Usani had mentioned before, bring them to Parkinson support group, bring them to Parkinson Society Singapore, so that we can can get them to exercise together. And also changing environments is really help to motivate someone to exercise, because a lot of my patients come to the clinic, all of them they will do exercise from for 30 minutes, 40 minutes. Once go home, no one do it. Yeah. Then I say, okay lah, next time I follow you home lah. Yeah, but I cannot. Yes. So I think it's the environment matter. So bring your loved one to the Parkinson support group and or Parkinson Society Singapore. I think it's really help. Oh yeah. I think it's which one?
A different institution will have their own support group. You can talk to your doctor, can refer to the support group. Yeah. At different hospital also have. It's depending on which hospital. You can talk to the doctor that I want to refer to the Parkinson support group. Then the doctor will refer you.
Singapore, do you, what? Do you, Parkinson, I2K area. Saint Luke, sorry.
Oh, St. Luke, yes, very good question. Actually, St. Luke also can be actually trained by the physiotherapist. If you want to be referred, you can inform your doctor. Actually, they'll submit through the AIC, and then you can go there for exercise classes. Can go there as well, because there are many St. Luke centers available in Singapore. Many centers.
there are a group is something like chit chat group. Down there, chit chat here, chit chat there, do nothing.
Oh. Yeah, thank you for the feedback. Because daycare center got different type of services. Either you go there, mingle around, connect, right? We support each other, or we can go there and do group exercise. But are you happy to go there? Yes. Okay, but try to get out, even go to St. Luke or anywhere. Thank you.
Thank you so much for your feedback. Is there any other last few questions that we want to have? Because I think we left with like last few minutes, like two
Yeah, so I was
minutes that we
just
have.
scrolling. I just had a look at some of those questions, so maybe I touch on them very quickly, lah. So I think one of you asked about what is that? Constipation, right? So I think constipation, I think it's best to see your GP or polyclinic doctor. They will refer you accordingly, lah. In terms of DBS, I think someone asked a question about DBS. DBS is available in Singapore, but for one of you who's having problems after DBS, I think you may have already been diagnosed with Parkinson's disease, so consult that with your doctor. I think, can you go down? Stem cell treatment is not available at this point in time. I think there's no, it is quite far down far off the horizon, so I don't think we see it coming anytime soon. Lewy body disease is one of the variants in a sense, so not true Parkinson's disease, but they may have some symptoms of Parkinsonism, which is what I spoke about. Madopa does not cause, another question was, Madopa does not cause agitation. I think you got to look for other causes of agitation. Yeah. Go down. Go down. Yeah. Yeah, so PD is caused by reduction. So the focus is, or sort of the overall processes do try and increase dopamine, in the brain actually. So that's what I think. I won't get the pharmacology can be quite complex, but these medications do indeed, I think you kind of hit the nail on the head. They do kind of aim to increase the amount of dopamine available to help the underlying disease process. Okay, any other questions? Yeah, if patients refuse to take medication, I think what doctors try and do is that they actually try and understand why. Okay, is there a particular side effect that's a problem? One alternative strategy I can also assess is talk to other patients who have Parkinson's disease and see that, hey, actually after they're taking medications, they might be better. They're not really, those fears that they actually have after eating medication may not be may be unfounded. Okay, and that may be an alternative strategy, that can be tried. Yeah, let's see if anything else I can help answer. Yeah, I think then there's too many. Okay, can.
I just add on the medication that doctor started. Usually doctors start very slow dose and then we observe for the side effect. So it's good to talk to your neurologist first when you start the medications. And when you're any doubt, you can actually get back to the neurologist and then we start slowly and then monitor the progress accordingly for your symptom management. And also I see someone is asking for references. Yes, I can share the references slide. And also someone asking about table tennis. PSS got the table tennis. Please visit the booth. They have actually a group to form to play table tennis. Actually, if you got more interest, you can talk to them. We can actually I believe we can come up with other activities that actually people with Parkinson can enjoy together with caregivers. Thank you.
Okay, thank you very much. I think we have a lot of questions that are being asked. So we thank all our speakers this morning for the information that we have. Is it one last question? Okay, I think we have.
Would taking dopamine supplements help?
I think those are the medication. I don't think these dopamine supplements are available over the counter, but or I'm not familiar with them. I think the means that we have to increase the amount of dopamine available are actually the medications that we give. Yeah.
Okay, thank you very much. Okay, welcome back. Our next speaker is Miss Samantha Howe. Ms. Howe is an occupational therapist from Singapore General Hospital. She has experience working in the inpatient, rehabilitation, and neurology wards. Her experience lies in working with patients with neurological conditions. She believes that occupational therapy should enable patients beyond the physical and must make the call to enable and empowerful, meaningful occupation seriously. Ms. Howe's topic title is Exploring engaging, and empowering. Ms. Hao, please. Thank you.
So, is it working? Okay. Hi, everyone. My name is Samantha. I'm an occupational therapist from Singapore General Hospital. So together with my colleague Wei Xuan, who is in the Mandarin session, cannot hear. Can hear? Okay. So together with my colleague Wei Xuan, who is in the Mandarin session, today we would like to share about activity engagement for persons with Parkinson's disease. So the title of our presentation today is Exploring, Engaging, and Empowering. So today we'll be talking about three different things, exploring, engaging, and empowering. So for exploring, we would like to explore various activities that you can do with Parkinson's disease, as well as to explore the impact that Parkinson's disease can have on your daily functioning. For engaging, we would like to talk about how you can continue to engage in your daily life despite the presence of Parkinson's disease. And lastly, for empowering, we would like to give you ideas on how to empower you to increase the type of activities you do every day. So just briefly, I'm not sure if anyone knows what an occupational therapist does. So I'll just introduce myself briefly. So occupational therapists work with a variety of clients with various diagnoses as well as from various ages. But in essence, occupational therapists believe in the importance of activity engagement for individuals to live meaningful lives, and we can help you find ways to continue engaging in activities that are meaningful to you. So we do this in three big ways. We provide recommendations and therapy activities to target both the body, so physical exercises, as well as mind exercises or brain cognitive exercises. So these are the three big ways that we like to help clients engage in activities. So firstly, adapting. So by adapting, what we basically recommend is to change parts of the activity that you do in order to help you do it better. For example, if you like to go shopping, you like cooking, but you find it very difficult to go around carrying your groceries or your shopping while walking, we would recommend you maybe buy a trolley, right? Another thing is if you like gardening and you find it very difficult to carry your watering can, then we would recommend maybe consider getting a hose. For restoring means to improve your cognitive and physical abilities through exercises that can help. For restoring, to improve your ability to do your desired activities. So for the physical aspect, an example of this would be doing strengthening exercises or balance exercises so that maybe you can carry your grandchild and spend time with them. For cognitive abilities, might be doing maybe memory practices so that you can remember what to do or buy during your next shopping outing. For compensation, when we compensate, we change the way you do the activity so that you can still do it despite changes in your physical or cognitive status. So an example of this might be if you like doing Tai Chi or doing exercises, to do it in a seated position instead. For aunties who like cooking very much and you find standing difficult, one recommendation maybe would be to buy a portable stove to put it on the table so that you can sit down to continue cooking even though you have difficulty standing. Sorry, I can't click. Okay, yeah. So speaking about needing to change the way you do activities, I also like to highlight some symptoms that Parkinson's disease might cause you, which might cause you to have difficulties in doing your daily activities. So I won't go through everything specifically because I know some things were gone through earlier, but things like slow movement, having a stiff trunk, having poor balance, tremors, blurry vision. For cognitive difficulty doing two things simultaneously, worsening attention and memory, reduced processing speed, and difficulties performing complex tasks. Yeah. So I guess despite these symptoms, it is still extremely important that we stay active and engage in daily activities, not only in routine activities like getting yourself dressed or taking a shower or having a meal, but also in activities that you love and enjoy. In fact, it's actually been found that staying active and doing meaningful things actually helps you improve your mood. It can also result in greater life satisfaction as well as relaxation. And as Hui Xin said earlier, it also can help you reduce your physical and cognitive symptoms. So I'll just touch on this briefly. I think Dr. Janesh spoke about this earlier. But after seeing your doctor may start you on Parkinson's medications, basically to increase the amount of a chemical called dopamine in your body. With more dopamine, you have less symptoms and you move more easily. So with the medication, sometimes these medications can cause some side effects. So this is a list of them. I'll just talk about two in particular that can affect your ability to manage your daily tasks and participate in your leisure activities. So these two will be the postural blood pressure drop as well as dizziness. So postural blood pressure drop means when you go from a lying down or a sitting position into a standing position, you can actually experience a temporary drop in blood pressure. So that might cause you to have some giddiness. Dizziness is also a side effect of the medications. And so what that places you at risk of is an increased risk of falls, especially if you want to go out for a walk, a jog, to exercise. So some things we recommend is to move more slowly. When you're lying down, you get up, sit down for a while before you stand up to let your kind of blood pressure adjust for a bit. Yeah. And so despite the negative effects or the side effects that Parkinson's medications can have on your body, it is still very important for you to manage your symptoms with these medications. So as I said earlier, when you take your medications, it increases the level of dopamine in your body. So this results in two timings. I think Dr. Janesh talked about it earlier, but the on timing and the off timing. And so I'll take a little bit more time to explain what these differences are. So for the on timing, that happens usually soon after you take your medications when the medication takes effect. So when the medication starts working, you have more of the chemical in your body, dopamine, and so you have less symptoms and you feel like your body is able to move more easily, more freely, in a faster way. And over time, as the effect of the medications run out, you move into your off timing. And so what the off timing is a gradual reduction of dopamine, the chemical in your body, which causes you also to slow down and have more symptoms again. So because the symptoms that you experience with Parkinson's disease during the on and off timing, it is so different. So while we know that doing leisure activities is important, the type of activities that you can do during on and off timing is very different. So in general, for on timing activities, we do recommend you to do more active or more activities that make you move more. For example, doing your gardening, going to shop, walking or jogging, cycling, cleaning the house if you enjoy it, or caring for your grandchildren, right? And then as your medications slowly wear off during your off timing, we usually recommend activities that are a bit more sedentary, where you maybe are sitting down a bit more, you don't have to move as much. So activities such as watching TV, reading newspapers, listening to music or the radio, taking a nap, chatting on the phone with your friends. Yeah. So in the next slide, I have a little activity. I think everyone's a bit shy, but you don't have to speak up. So we are going to practice categorizing activities into on and off activities. So remember that on activities tend to be bigger, require more movement, and off activities tend to be more sedentary. You're sitting down a bit more. So, but keep in mind that an on activity for someone might be an off activity for someone else, depending on the severity of symptoms that you have. So there's no right or wrong. But so in the next few slides, I'll show you a picture of an activity. If you think it's an on activity, can I please get you to either stand up or raise up your hand? Okay. Okay, let's try. Okay, so the first one, watching TV using your phone. If it's on, on, off. Okay, very good. So this is an off activity because you don't have to be standing, you don't have to move around that much. Okay, next one. This one. On, very good. Yeah. So you can see, I mean, I chose these two pictures or these three pictures, but the one on the left and the right specifically because it is an on activity. However, depending on how the severity of your symptoms, you might choose to do it differently. For example, the guy on the left is doing it, uncle on the left is doing it in a seated position, whereas this uncle is doing it on the right. He's doing it in standing. And you see he's using a watering hose lah. So maybe, he has difficulties with balance. Maybe he cannot hold the gardening hose and stand at the same time. So he's adapted and chosen to use a watering hose instead. Okay, next activity. On, off, yeah. So I think this is a bit more, it can be on and or off, depending on the severity of your symptoms. For some patients who have, less symptoms, this might be quite sedentary. They're sitting down, just shuffling the mahjong tiles. But for patients with more moderate or severe Parkinson's, this might be quite difficult because it does require quite a bit of fine control in your hand. If you have a lot of tremors, shaking, you might find it difficult. Also, having to stay seated upright like this for a long time, it may be difficult for some patients too. Okay, and this activity. Off, yeah. So in general, this, will be more of an off activity. I've heard of patients who have difficulties, they like to play instruments and they have difficulties doing it. So some have adapted and chosen to do this instead. Okay, so the last thing is we have an activity. I think it's not given out yet, but I've printed a handout and maybe I'll just go through how to do it. This is everyone should get one. This is a take-home activity for you to do when you go home. What I want us to learn is to learn how to schedule activities into on and off timings, depending on your medication timings. And also to brainstorm activities that you want to do, that you want to start doing in your daily life so that you have a better idea of when you can do it. Yeah. Okay, so I think they're handing it around now. But if you have a pen, you can write down and follow along. If you don't, then you can just listen and then go home and do it. Okay, so the first thing I'd like you to do is on the top right-hand corner of this handout, you can just take a few moments kind of to think about some activities that you want to do, that you find difficult doing, or that you want to do and haven't done yet. Okay, so if you have a paper, you can just you can just write it on the top right-hand corner. Okay, so that's in the top right. Yeah. And then there is a blank for the medication timing. So medication timing differs for everyone. For some people, it's 9 a.m., 12 p.m., 3 p.m., 6 p.m., and 9 p.m. again. For some people, it might be just 3 times a day. Yeah, so just fill that in, depending on what your regime is. Okay, sorry, it's a bit messed up on the slides, but then I want you to go down to the timing section and to fill in the time. So I want you to start from your first medication time. So if you start at 9 a.m., the first blank will be 9 a.m., and then 9 to 10, 10 to 11, 11 to 12. So if yours starts at 8 or starts at 7, then you just write it in accordingly. Okay, and then in the next row, there is on and off timing, and that's when you circle whether you think you are on or you think if you are off. Okay, so you don't have to fill it in now, but when you go home, I just want you to take note of either yourself or your loved one, take note of when you feel the medication starts to work. So for some people, after they take their first dose, immediately they start feeling, easier to move. Then that will be on timing. So if you take medication at 9 and you move well, then circle on. If you feel like only closer towards 10, you start feeling on, then you would circle off in the beginning and then on below, just like this. Okay, and then I also want you to take note of when you start feeling off or when you start feeling the symptoms coming back more again. And that is when you would circle off. Okay, so then based on the activities you wrote on the top right, you can, as you practiced earlier, categorize them into on or off. So for example, I wrote here walking. I like to walk. If I like to walk, I'll write on next to it. I like to clean the house, I put on. Part of my routine is to read the newspapers, I would write off. And then maybe going for karaoke with my friends, then I write off, on next to it, because I need to walk out and go out to karaoke to meet my friends. Okay, so based on the on and off categorization that you put in the top, you can then fill that into the table below under activity. So following the on and off timing. So for example, walking, I see that my timing for on is 10 a.m. 10 a.m. not too hot yet lah. So then maybe I'll write walking in 10 a.m. So try to create this routine of knowing when you can do the activities that you want to do based on your individual medication regimes. Okay. So I think last but not least, I'd like to share that if you find it difficult to engage in activities, it's important to do. You can attend support groups, leisure activity groups, and I know later there'll be a presentation from the Parkinson Society Singapore, so I won't spend so much time on it. But they do run leisure activity groups, a variety of activities such as Tai Chi, karaoke, calligraphy. So both very on, very active and very sedentary activities. So you can consider attending these. I think there's a small cost. I'll let the presentation there inform you more about it. But I've added a QR code on the top. This is what their website looks like. So if you're interested, you can scan or maybe find out behind more later. Yeah. So thank you. I hope that there are some good takeaways and that you're able to use the handouts we've created for you to kind of engage and schedule your day better to do leisure activities. Thank you.
Yeah, thank you, Ms. Hao. So thank you so much for this informative sharing. Next speaker, we have Ms. Charmaine Trisha Chok. So Charmaine is a speech therapist working at Singapore General Hospital. She graduated from the University of Queensland in 2018 and was awarded a Bachelor of Speech Pathology with first-class honours. She works in an acute ward, primarily with adults who have speech, language, cognitive, communications, and swallowing difficulties. Specifically, she also has an interest in working with patients who have stroke, Parkinson's disease, and other neurological and neuromuscular conditions. She focuses not just on diagnosing and providing rehabilitation, but also draws on her experience to educate patients and caregivers to empower them to advocate for themselves and better understand their swallowing and communication difficulties. She'll be sharing on safe swallowing and speaking loud. Ms. Chok, please.
Thank you, Jeremy. Okay. All right, so I'm going to be talking today about swallowing and communication, which is the two main areas that speech therapists specialize in. So we'll talk about the ways that Parkinson's disease can affect your communication, your cognition, and your swallowing. I won't delve too much into the other symptoms and the medication because it's already been covered by Dr. Janesh earlier and the other presenters. So firstly, how does Parkinson's affect communication? So one of the first things that, one of the main things actually that Parkinson's patients report is that they find that their speech starts to get softer, more hoarse, a bit trembly over time. It's possible that your caregivers might hear those changes before you do, and this is to do with the way that Parkinson's affects your perception of your movements. So you might think that you're speaking really loud, or you might think that you're speaking at a normal volume, but actually you're speaking softer and softer and softer. And your brain kind of just tricks you into thinking that you're speaking at the same volume. So by the time that you need to speak, so if you need to speak at the normal volume for people to hear you, you might think that you're shouting, but actually you're not. So I want you to raise your hands if any of these statements apply to you. People cannot hear me. My voice is soft, breathy, and hoarse. People often ask me to repeat myself. Yeah, I see a few hands. Yeah, so you're not alone. It is very common Okay. If you find that your pronunciation is not clear or your speech is not smooth, raise your hands. Yeah. If you feel like you get stuck trying to say a word, or sometimes you repeat, you have involuntary repetitions of your words and your sounds, your speech sounds, right? Yes. So these are all symptoms of Parkinson's and how they affect your speech and your voice. It's a motor symptom, right? And the way that speech is produced, it's very complex. I'm not going to go too much into it. But what I want to tell you is that it's not that your lungs are getting weaker, your voice muscle, your tongue is getting weaker, or that your speech muscles are getting weaker. The main reason, especially in early Parkinson's, that your speech gets softer is that your brain, like I said, tricks you into thinking that you are speaking loudly. And so we have to overcompensate for that. So this is where speech therapists come in. So we help in a number of ways with communication. One of the first things that we consider is direct therapy with the patients. So this is one of the most well-known treatment types is called LSVT, or the Lee Silverman voice treatment, voice therapy. So with this, we work with patients to get them to recalibrate, to realize that, hey, actually, when I speak at this volume, I'm not shouting. My loved ones can actually hear me, and help them to kind of like get accustomed to a new normal. Sometimes patients might not be suitable for direct therapy, either because of poor motivation or, like what was covered earlier, reduced memory. In this case, we might get caregivers to help with compensatory strategies, or we might start to think about alternative communication methods. So what is commonly referred to as AAC. So to either completely or partially replace the role that speech has in communication. Okay. So this other means of communication can be, it encompasses a big range. So it can be gestures, even pointing like, yeah, I want that one over there. That's a alternative or a augmentative form of communication to help others to not just hear you, but see what you are referring to. It can also be pen and paper writing. It can be letterboards or some communication apps where you can click on a picture and it says a word for you. Or it can be quite a low-tech like picture communication board that you carry around with you, so you don't have to worry if your iPad battery is flat, yeah? Okay. So we're going to do an activity now. Okay, I don't want anyone to paise, so it only works if everybody participates, okay? So I'm going to show you what we do, one of the simple exercises that we do with patients with Parkinson's to kind of like help them to find that they actually do have a loud voice, okay? So when you do this, so first I'm going to do it, then I'm going to get you to do it with me. And I want you to think of maybe like a drill sergeant or army sergeant, giving orders, very strong, very, set up straight, you channel that loud voice. You should not be shouting. You should not feel pain or strain at any point, okay? So I'm going to take the mic away because it's going to be loud, okay? First, I'm going to take a deep breath. Very good. So I heard some voices. Now I want everybody to try with me, okay? Deep breath. As loud as you can go without shouting. Very good. If for some of you, this might kind of like be the loudest that you've heard yourself in a while, okay? This shows you that you do have a loud voice, okay? I'm going to do a little bit of talking practice. So I'm going to do counting, and then I want you to do it with me, okay? 1, 2, 3, 4, 5. Right? So it's loud, but you're not shouting. I'm going to try using the loud voice, the same loud voice, to say, hello. Oh, wait. Okay. 1, 2, 3. Hello. Right? So I wasn't shouting at any point over there. I was just using a loud voice. And you can too. Okay. The other thing that we might do for patients with Parkinson's is introduce a strategy called pacing. So it's the use of an external cue, like a either squares or kind of tapping on your thigh to help you to produce like one sound block at a time. And this helps if you have involuntary repetitions, if you find that you're speaking very fast and mumbling. And by slowing yourself down, you actually help others to hear you better. Okay. So I'm going to do it first, and then you're going to do it with me, okay? We're not going to do everything. I'll pick out a few phrases for us to do, okay?
Hello. Okay. How are you? Okay. I want water.
Right? So at first it will sound unnatural to you to break up your sound so specifically. But the more you practice using the strategy, the closer you'll come to finding a new normal, a new balance between sounding intelligible, sounding good for other people, and sounding natural. Okay. So the other way that Parkinson's can also affect communication is by altering your cognition. So a lot of the other speakers have already talked about this. I'm not going to go too much into what happens with cognition, but rather how it affects your communication. So you might find that you need more time to think, or it's hard for you to multitask. Like if there's a TV on in the background and your daughter, your son is talking to you, and you're just like, don't know what to focus on. Or you might find that you're more forgetful, like even forgetting to take your medications. So like what Ms. Usani said earlier, having to set reminders to take your medications, for example. Okay. What caregivers can do is use some of these strategies to facilitate communication with your loved ones. So reducing distraction and background noise, and kind of get their attention first before you talk to them. And then when you do talk to them, use shorter phrases, shorter sentences, and make sure that they can see your face and hear you and are actually paying attention. If that's still difficult, then you can offer choices like, do you want chicken rice or curry for dinner, right? Or are you in pain? Have you had your medications? What you should not do is sit in front of the TV, look at the TV, eat your dinner, and then kind of like talk, and then hoping that your loved one with Parkinson's can hear you or is paying attention. Then if they never reply, like, hey, you got listen to me or not? So that's hard for them to pay attention to, yeah? Okay. So swallowing. Parkinson's disease can also affect swallowing. I saw earlier in the question board that some people had questions about swallowing or what we call dysphagia. So swallowing difficulties is a motor symptom, but it's also a sensory symptom. So what happens is that it's not only harder for you to chew and swallow, but also you are less aware of food in your mouth, saliva pooling in your mouth, and so you don't swallow it, and then that increases your risk of choking or saliva going down the wrong way or drooling. Some of the possible complications of this are or what we call aspiration pneumonia. And this is the thing that we are really trying to avoid because it can be quite severe for especially our elderly patients if your loved one has a lot of other medical conditions. So signs of a chest infection, having a fever, having thick phlegm, having shortness of breath. And if any of these symptoms are observed alongside what I covered earlier with the difficulties with swallowing these symptoms, then we might talk to you or your loved one about doing a swallowing x-ray or doing a endoscopy. So kind of like having a little camera put down your nose to kind of see what the food and drink is doing when it goes into your throat, whether it goes down into the airway or into the food passage. Okay. So very important, if you have any swallowing difficulties, or actually even if you don't, this is very, very good information and should just be applied at all times when you are having food and drink. So firstly, sit upright, don't lie down, lie on the chair, turn your wake up from bed and then turn your body to just drink from the cup. No, sit up. And if you have trouble keeping upright, sit in a chair with back support. Don't lie down immediately after meals because sometimes, if you have reflux or there's any more food and drink that you aren't aware of in your mouth and haven't swallowed, that can go down the wrong way. So Samantha talked earlier about your on-off timings. So try to have your meals around your on timings, especially if you notice that there's a big difference in your movements between your on and your off timing. Pay attention to your meal. Don't talk when food is in your mouth. Make sure you swallow everything before you take the next mouthful and before you start talking. Okay. And then the last point, using easy grip utensils. So these, you can speak to your occupational therapist about, making adaptations to the utensils that you use so that it's easy still for you to feed yourself and not have to rely on your caregiver. And I think this is especially important if you have like tremors that prevent you from being able to feed yourself very well. Okay. Speech therapists might recommend chopping up food into smaller pieces, cooking it softer, or thickening liquids to make it flow slower and for better control. It's also possible, because Parkinson's is a degenerative condition, for your swallowing to deteriorate over time, possibly to the point that even with modifications to your food and drink, you are still at a risk of having food and drink enter your airway. So in these more severe cases, your speech therapist or your doctor might speak to you about alternative nutrition methods, such as a nasal tube or a stomach tube to provide nutrition for you. This is this isn't the case for every single patient, so don't panic, okay? If it comes to that, then your speech therapist and your doctor will have a conversation with you or your loved one. Okay. Drooling is I see everybody taking out their phones. Okay, so drooling is a pretty common symptom of Parkinson's. It's not because you're suddenly producing more saliva, no, it's because you don't realize that there's saliva in your mouth and that kind of pools and then it starts to come out of your mouth. This can also be worsened by how you sit. For example, if you kind of like tend to tilt forward and your mouth it's hard for you to close your mouth, then it's more likely that the saliva will flow out. How to manage this? Okay, all the phones again. So the easiest thing to try is to set reminders, but that can be very inefficient because it's for a person without Parkinson's, without any other medical conditions, we swallow multiple times a minute. So you're going to probably have to set a reminder every 2 minutes or 1 minute, and that will be very annoying for you, huh? Sugar-free sweets can kind of like produce enough sensation in your mouth to remind you to swallow your saliva, making sure you always remember to purse your lips tightly so that if saliva pools in your mouth, it doesn't drool, or carrying a handkerchief or a tissue to wipe up. There are medications in the market that can help to reduce saliva production, but it does have side effects, even especially on your chewing, your swallowing. So this is not a standard practice, but if it's a big concern, then we can get you to speak to your neurologist. Okay. Caregivers, when serving food to a loved one with Parkinson's who also has swallowing difficulties, make sure the food is cut into smaller pieces, either minced or sometimes even blended. Look out for coughing and choking during meals and monitor their alertness. If they start to fall asleep, then stop. Don't keep waking them up to eat, yeah? So then stop the meal. Okay, so that's it from me. So remember to stay active, swallow safe, and don't stop talking. Okay? Thank you.
Thank you, Ms. Cho. Next, we are honored to invite Ms. Phyllis Lim from Parkinson Society Singapore. Phyllis is currently the Executive Director at Parkinson Society Singapore. She has over 25 years of experience in the social service sector, supporting individuals, families, special needs, and vulnerable seniors, both in institutional and community setting. Phyllis is a registered social worker with Singapore Association of Social Workers. She's also an associate faculty with Singapore University of Social Science at S.R. Nathan School of Human Development. Ms. Phyllis, please.
Very good morning to everybody. Good morning, I cannot hear you. Okay, yes. Okay, I'm between you and lunch, right? So I'll make it very sharp, all right? I'm Phyllis from Parkinson Society Singapore, the only one in Bishan, and we are easily accessible by train and bus and centrally located. So let's watch a video first before we start, all right, on what we do at Parkinson Society Singapore. Thank you very much to everybody here in the technical team. Thank you. Okay, about Parkinson Society Singapore, we are started by a group of doctors and caregivers in 1996. And in 2000, we registered ourselves as a charity. And in 2013, we have our Bishan Center under the HDB Void Deck as Parkinson Society Singapore. So as can see from the video earlier, our mission is to promote awareness and understanding of what Parkinson is and the related disorder. Because Parkinson strikes everybody differently. Okay. Some of us may have certain symptoms, other of us will have other things. So it's very good to come together as a community to understand and cope with the Parkinson together. So as you can see, our objective is to translate knowledge, create awareness, provide therapeutic programs, as well as to form a community, a kampong, a village together while journeying with Parkinson disease. So how much exercise does one need? Oops, it's not working. It doesn't want to exercise. How? Make a guess. How much exercise do we need a week? How many hours? Wow, bingo, you got it. Minimum, this is bare minimum, okay? Bare minimum, we need to do at least half an hour a day, all right? To keep ourselves active so that our circulation, our muscles and our joints are working, all right? And we constantly need to keep our heart going and also keep our circulation going. So these are the exercises that we have at the center that is good for persons with Parkinson. Okay? Because biologically, we are already intervened at a hospital with medication and diagnosis, right? What is next? Next is up to you and me, whereby we come together to do all these activities here. And of course, as we journey with Parkinson's, our voices may become smaller, which is why our earlier colleague talked about speech therapy, talk about having to talk, to flex our vocal cords all the time. Because our vocal cords not only help us to speak, it also helps us to eat and swallow, right? So over at Parkinson Society Singapore, we try our utmost to provide holistic care through PIC. What is PIC? Person-centered care. All right. So with this person-centered care, we focus on all the 4 domains. The first domain of biological is already attended to by the hospitals, the doctors, and the allied health colleagues. For the psychological part, we come together socially as a group, and all the rest of the domains will be taken care of when we make an effort to come together. All right. And of course, at the Void Deck, under a HDB block, at Parkinson Society, we have 28 programs. And these 28 programs translates into 56 classes every week. So we are so holistic to the extent whereby we have so many programs and we have so many classes. So don't tell me, bojo, okay? And also don't tell me you got no time, okay? Because there's such a long schedule and a variety of programs whereby we try to suit to everybody's needs, all right? And it refused to exercise again. Oh, not working. So where should I point? Okay, I should point. Okay, over at our end, we have educational workshops. Okay, we will talk about fall prevention. We'll talk about LPA. We'll talk about caregiving. We'll invite experts from our community partners, especially NNI, SGH. We have very strong partners in Dr. Tan, Sok B, in Sister Usani, and from everybody will come together to give all these meaningful and insightful talks to us so that we can learn more about Parkinson. We can learn how to live with it, how to be a companion, a good friend with Parkinson. And of course, for you to be at Parkinson Society Singapore, you have to be referred. It is a private club. You have to be referred by your doctor through AIC, then you can come into Parkinson Society. Because at Parkinson Society, we promise private at affordable prices and a safe haven for everyone. So we can all feel at home when we are at Parkinson Society. We can share with each other. We can't sleep, or we are anxious, or we face certain things. How do we go about it? All right. So this is where the referral process comes through. So you can definitely feel very safe at Parkinson Society Singapore. Plus, all our programs are adapted and targeted to journey with Parkinson's. And of course, one of our mission is to outreach, right? It is our duty to tell everybody out there what is Parkinson. Because Parkinson is like when I go and order my favorite bak chor mee, with that buzzer, right? I go back to my table, right? And I'm waiting for the buzzer to buzz, right? So that I can go and take my favorite bak chor mee when it's ready, right? Parkinson is such whereby I can order, collect the buzzer, go sit and wait. But when the buzzer goes off, I can't even go and collect my noodle. It is because my medication is off, or suddenly I just have an anxiety and I will just freeze there. So that is Parkinson. So we need to continue to outreach, come together like today, whereby we continue to know and understand and try to create an inclusive society for persons with Parkinson. Okay? So these are our outreach with all our members, our community partners, our students, and we attend all the programs and the events conducted by our partners. And this is one of our events where we had last year at our Tampines Hub, whereby we identify 3 Parkinson Star awardees. And today we're actually very blessed. All 3 of them are here. Mr. Philip Bay, Mr. Chua Dek Kun, and Mr. Tan. So if you can identify them among the crowd, you can actually have a chat with them to find out from them more. How do we live a quality life with Parkinson? All right. And of course, we're a charity lah. So we need to have fundraising events all the time. Okay. And these are our publication to create awareness, our newsletter, our book by Prof. Louis Tan, and of course, our exercise book and Embracing the Odds. Okay, so last year was 12 Parkinson Star Awards. This year is the 13th. So if you know of anyone who is exemplary, motivating, and can show an inspiring example like our 3 warriors here, please nominate them. And these are our voices of our warriors. And these are awards that we have garnered over the year and our volunteering opportunities. And this is how you can come forward and support persons with Parkinson and Parkinson Society Singapore. Thank you.
Maybe I start with occupational therapists first. Can patient with Parkinson disease go for swimming?
Can hear me? Yeah, so of course with Parkinson's disease, I think it's hard to tell you what activity you can and cannot do because the symptoms and the presentation is so different. I guess if you're going with someone, if you're not very sure if you can do it, someone that would increase the safety when you're doing it. But I think it's difficult to say whether you can or cannot. But it's surely a good exercise and good activity to engage in. Yeah.
Right. Next one, also for you, Miss Samantha, regarding activity scheduling, sounds like a good idea. Thanks. For medication taken at 12 noon, for example, does the on period happen at the same time for all patients, or how long does medication last? I guess. Yeah.
Yeah, so from what we've seen, medication, your on and off timing differs for everyone. We've seen patients who have off timing very soon, maybe half an hour after they take their medications. For some clients, it does take a little bit longer. Also, the effects of the medication varies. So for some people, if the medication works for 3 hours before they start feeling off again, then it's longer. For some patients, it might be shorter. So if you feel like your on time is getting shorter and shorter, that's an indication for you to speak to your doctor on how they can maybe optimize your medication regime so that they can support you to engage in activities better throughout the day.
Right. Next one for Charmaine. Will dysphagia cause thick mucus over time?
So thick mucus can be a symptom of having pneumonia or chest infection, and that can result from having swallowing difficulties, especially if you're swallowing difficulties and maybe the food and drink is not modified appropriately for you. So if you do notice this, so firstly, if you do have thick mucus, then treat it as a medical event. Consult your GP, especially if you have other symptoms like having a fever or shortness of breath. If it is a chronic thing and the GP has no idea what's going on, and you suspect it might be because of dysphagia and your swallowing difficulties, then do have a chat with your speech therapist to see how we can help to make recommendations for your food and drink and other strategies to reduce the risk of developing a chest infection due to swallowing difficulties lah.
You. One more question. What if I cannot swallow my medications?
Okay, so this is actually a really common one. So some Parkinson's medications can be pounded. If so, we say, okay, go ahead and crush the medications, check with the pharmacist and your doctor. Some medications cannot be pounded, in which case the pharmacist will have to make a recommendation for an alternative that can be either dissolved or opened up, so that can make it easier for you to swallow with liquids. So if you find that you have difficulty swallowing your medications, first speak to your speech therapist, and then also speak to the pharmacist or your doctor if your speech therapist recommends that you crush the medications.
All right, thank you. Next question for PSS, Miss Phyllis can answer. They're asking if there's any other place other than Bishan, because some patients are actually wheelchair bound, does not have caregiver, have difficulties going to Bishan itself lah. Yeah.
Okay. PSS is only at Bishan for the time being. While we hope to open more centers, but the conditions need to be right lah. But for now, it would be good if we can, for example, in our daily life, we make a routine to pop by PSS at Bishan, maybe once a month for a start. And for all you know, as it becomes a routine, you will actually look forward to come. Because when you come, you can actually feel the kampong spirit and the love and the belonging and the myriad of activities that you have together with your friends with the same condition. We have members coming down all the way from Tampines, all the way from Bedok, all the way from different parts of Singapore, and they spend the day with us. And at the end of the day, they have more dopamine, they feel more active and more rejuvenated. So I encourage your dad to come down, though he is in a wheelchair. It's still possible. Thank you.
One more question for you. If the referral is made by doctor to AIC, does it require means testing to qualify?
Yes, our physiotherapy and speech therapy is means tested, and it has to be routed through AIC. I'm actually very grateful for this question because earlier on, Edward also pointed out something that I need to clarify because there was a very limited time just now, so I was a bit rushing through. We have how many programs? Let's test if everybody is listening. We have 28 programs, right? Out of the 28 programs, we have 26 programs. That is at $10 each. No need means testing, no need AIC. The other 26 programs are things like yoga, Pilates, Tai Chi, singing, arts and craft, talking therapy, the list goes on. All right. There are only two programs, which is the physio and the speech therapy, that has to go through AIC and the doctor in order to be means tested. Because these two programs are actually quite expensive. I don't want to go into the technicalities, but we all know the technicalities lah, huh? But for the rest of the programs, you only need a doctor's note to certify that you have Parkinson, and you can join all our adapted programs, adapted dance, adapted everything for Parkinson. Thank you.
Thank you. Next question. Any advice on home modification? If I have family member with Parkinson. Next question. Any advice?
So for home modifications, it depends on whether the family member is ambulant or walking around or is in a wheelchair. So for people with Parkinson who are ambulatory or who are walking around, but might have difficulties, for example, performing a sit to stand or standing up because of stiffness, some things we can recommend would be, increasing the height of the chairs that they sit on. For patients with reduced balance, you can consider installing grab bars into the house. For some patients who maybe are sitting more in a wheelchair, things like making the space a bit more spacious so that the wheelchair or the toilet chair can be pushed around the home. Also installing ramps. And these are things that can be done by HDB in a program called HDB Ease. So if that's something you are looking into, I would recommend you search it up online and apply.
Thank you. Next question, Charmaine can answer, I think. My dad with Parkinson groans and makes consistent sounds. He is currently non-verbal. Is there a known association between Parkinson and non-verbal vocalizations? He is currently non-verbal.
So non-verbal vocalizations like other involuntary movements can occur, especially with the later stages of Parkinson's. There is, at this point, not a specific cure or strategy that we can use, but if you find that this happens during particular times when he's kind of like more awake, or he's also very fidgety and restless during these times that you notice these, then it's just providing reassurance lah. So it's involuntary, and it's one of the things that can happen with Parkinson's in the later stages.
All right, thank you. Before I proceed, is there any questions from the ground? Y'all can one over there. Thank you. Before I proceed, is there any questions?
How to improve? When you got something to say, the word is just at the end of the tongue, just the thing will come out. How to improve?
Okay, so the gentleman over there asked, how do we improve if we have this kind of like tip of the tongue sensation when we are trying to say certain words? So this is what we usually describe as word finding difficulties. Some of the strategies that your speech therapist might recommend is, taking time, just really slowing down what you're saying. So using pacing to allow yourself more time to for your brain to kind of like catch up to what you're trying to say and to find the word. Sometimes it's using other words to describe what you're trying to talk about. So if you cannot find the word, then you talk about things, you try to describe it in a different way. And if it's just not coming to you, then it's okay to kind of leave it be. And if it comes to you later, to just pick it up again. So it really also depends on whether the person that you're talking to understands that you have this difficulty with Parkinson's. And so you or your loved one may have to advocate for that, to say that, hey, look, I have Parkinson's. And because of this, it's sometimes hard for me to say the things that I want to say, and I will need more time. And the people around you should understand and take that time, let you think of what you want to say lah. And the people around you should understand and take that time, let you think of what you want to say lah.
If you are facing this problem in front of a, let's say, hawker center, as those selling store.
So I talked earlier about other means of communication. So speech isn't the only way that we communicate. It can sometimes be with pictures or with writing, or at the hawker center, just pointing. And the hawker center, the hawker might try to guess what you're pointing to. And it will take time, but it's okay. Or if you already know in advance what you want, but you have trouble saying it, and if you have someone with you to get them to speak for you, to tell the hawker, okay, yeah, you want this one.
Anyone else? If not, next question for PSS, Miss Phyllis. Would you consider having a shuttle bus service from key areas, or provide transport at a fee?
That is actually one of my own personal dreams, to have a transport. But in Singapore, we all know maintaining a vehicle, insurance, driver, scheduling and all that. For the time being, PSS would want to just focus on our strength in our programs and services. For transport, for the time being, the other transport providers can help lah, which is how our current members are actually accustomed to lah, if I can say. Thank you.
All right, thank you. Wait, I still got a question for you. So, to join PSS alone, anyone with PD can join as certified by a doctor, but to attend the physio, it has to be means tested lah. Is that right?
Yeah. Okay. Okay. Let's have a process inside this. Number one, I'm diagnosed with Parkinson. Number two, the doctor will refer me, put me through the AIC system so that I can attend physiotherapy outside of the hospital. The purpose of having a community partner is because the community can provide alternative physiotherapy sessions. And for us to be put inside these physiotherapy classes, we need to be checked out by our PSS physiotherapists so that we can be determined whether we are advanced, intermediate, or strong. And then we can be banded into the right class. And then we will be means tested. For a charity like Parkinson Society, money is always the last in my head. We have patient welfare fund. We have all sorts of funding to help each other. So the most important thing is to right side you, at the right school in the right class, for example. I hope that answers the question.
Yep. Okay, another question related to that. My father currently receiving subsidized PD sessions at St. Luke. Is he still eligible for subsidized session at PSS since it was mentioned earlier AIC referral is required?
Yes, well done. I'm also very grateful for this question. We're all Singaporeans here, right? So we will understand what's the meaning of double dipping, right? Answer is no. We cannot be double dipping. So sorry lah, you have to make a choice whether you want St. Luke or you want PSS.
All right, thank you. Anyone else from the ground have any questions?
Maybe just one last questions before we close the session today. Yeah. If not,
Anyone else from the ground?
if not, thank you very much. I think it's a very informative session. So with that, you have now come to the end of the public forum. So we would like to thank Kieta A Community Club, our sponsor, Parkinson Foundation, all our partners and all our speakers today for sharing their expertise, and hope that all attendees who join us have benefited greatly from the talks. By the way, we still have a lot of bananas left over, so if you'd like to bring some bananas home, please help yourself at the redemption counter as well. All right, so a big thank you to all participants who join us today at Kieta A Community Club, and all those who turn up in on June for spending your precious Saturday morning with us. Please help us to scan the QR code. Very important to provide us your feedback so that we can improve on future public forums. Till we meet again and have a wonderful weekend ahead. Thank you.